Hello, David Fife with Lake Country Acupuncture doing this is a little bit of a offshoot of our healthy tip of the day. I wanted to explain to you guys with this lovely patient here how we actually do a lot of our treatment work. I've explained this in the past, but I want to explain it a little bit more closely. So with this individual, we're dealing with some pain in the knee, and it's usually counterproductive if we're just going to stimulate the knee directly. Because a lot of the time, if we're using acupuncture for a musculoskeletal problem and a pain issue, just putting needles where the problem is if at all, a temporary relief, but it doesn't actually resolve the issue. And the way that we resolve it is through stimulating circulation systemically through the region. And by doing that, we're not forcing anything locally. When a joint or a part of the body is in pain, or it's locked up, or there's inflammation in the region, putting needles in directly is just only going to exacerbate an already tense reaction. So it's going to make it more tense. Eventually you may get a release there, but it's only temporary. From my clinical experience, it's about getting circulation to circumnavigate through the region by using areas that are away from the area that trigger that response through the brain. So I'm going to demonstrate that. So for this knee, we're using the contralateral side of the body, and we're using the opposite elbow to stimulate the knee, because that triggers the response in the brain to vasodilate indirectly this area, and we're not forcing anything, we're gently encouraging it to move, and in that way we can get immediate change. Okay, so I'm going to do that now. I'm just going to swab the point a little bit here, and then I'll show you the areas. So if the pain is more on the medial side of the knee, we're going to be using the medial side of the arm, and that's what we're going to do here. So we're going to use an area right here on the elbow to affect this part of the knee. In this case, it's kind of the whole knee, but she's doing really well right now, so this is more just for a demonstration, okay? So the needles go in here, right along the elbow region, and we're coming along certain muscular seams here along the arm. It's a very simple procedure, and if done right with this technique, the results should be immediate. You should feel it within 10 seconds of the needle insertion. Now that relief may not last right away, but when we repeat the process with time, then you can get lasting relief, okay? So we've got 9 needles in, very quick insertion, not too much of a sensation, but sustained in that region. It's going to stimulate the brain to vasodilate this region and clear out the inflammation that's generating the problem, and actually get a resolution and a correction to the problem. So one of the many ways we do things. Thanks for staying tuned to what we do, and we'll see you next time for another healthy tip of the week. All the best.